Well, we have new mechanisms of action, right, on some of these new meds. So, Andrew, let's run through some of them. We have teriflunomide, fingolimod, dimethyl fumarate. What are the potential benefits of these new mechanisms?
Well, firstly, they're soluble medicines, and therefore they can be administered by oral ingestion, and so that obviously creates a greater likelihood of convenience for the patient, and therefore I think compliance, we hope. Apart from that, I think the solubility also gives us the opportunity to perhaps get the drug into the central nervous system, whereas the other protein-based, large protein-based molecules, the biologics such as interferon and the infusible drugs such as natalizumab, for the most part, to our knowledge, are not getting into the central nervous system. So the action or mechanism of action on the immune system is in what neurologists think of as the peripheral immune system, meaning the rest of the body.
So it's kind of a win-win.
Well,
they're orally available and they cross the blood-brain barrier.
And yes, so by crossing the blood-brain barrier, it is at least plausible that there will be not only immunologic effects within the CNS, because we do believe there's some ongoing inflammatory activity, meaning the immune system is overly active within the CNS. If we can get at that more directly, there may be a benefit. But beyond that, for example, in the case of fingolimod, there are the target is modulation of what are called sphingosine-1 phosphate receptors, or S1P receptors, and there are S1P receptors within the CNS. And it is at least plausible, and there are some in vitro, meaning test tube and animal experiments suggesting that there may be a beneficial effect on the type of cells that make myelin, which of course is a critical tissue that is attacked in MS. And further, the dimethyl fumarate, for example, which we believe is working through what's called the NRF2 pathway, which we think is going to activate antioxidative genes and hopefully work in some sense as an antioxidant factor within the CNS, that might have tissue protective effects on the axons, the nerve fibers themselves, which seem to deteriorate possibly because of stresses on their oxidative metabolism.
And then the third one, the teriflunomide, is a pyrimidine synthesis inhibitor, right?
Yes, so a different way of working on the immune system and modulating the immune system that is aimed at trying to control the process without overdoing it.
Well, again, I come back to the question I asked you before, and we can all chime in on this. These are different pathways. They all attack in some immunomodulatory way the immune system in the CNS. How do you pick one to start with versus another?
So to be clear, Peter, we don't know that they're affecting the immune system within the CNS. That was a speculation on my part.
Okay. With that said, there are different mechanisms that are proposed for the action of these drugs. Let's be very precise about it. But they're different mechanisms. So how do you pick one versus the other? Gee, today's a sphingosine day, or tomorrow is a pyrimidine day.
I think Pat made it kind of clear that, you have to kind of look at the individual patient. You have to be thinking about, what is the best available therapy for that particular patient's disease phenotype, we'll call it.
Okay.
And then in a conversation, as Stephen mentioned, look at what are the side effects, what are the safety issues, what are the concerns that the patient has about taking whatever drug it is, and you have to kind of factor all that in to make a decision ultimately. So, it may be that there could be some comorbidities that the patient has that makes you concerned that if I put them on this drug and, let's say it affects heart rate or something like that they're on these drugs, maybe I shouldn't use that medication, or they have a history of diabetes or, some other dermatologic or liver issues, right? So, you kind of have to take all of their medical history. You have to factor in what their risk what their risk tolerance is, what they feel comfortable with, what you feel is the appropriate treatment, and then you make a kind of a pact with the patient about what you think is going to be the best treatment to choose.
You alluded to the antioxidant.